Well, good morning, everyone. I'm Diane Smith, and on behalf of the Melbourne Chamber of Commerce, welcome to another COVID-19 webinar for business leaders. With us all being in a second lockdown in Victoria, today's topic, the impacts of COVID-19 on workplace mental health and what businesses can do, is timely and important. We know that businesses are thinking very carefully about managing their people, managing the mental health dimensions of the crisis, and also just keeping the business running in this context of increasing numbers of mental health issues and increasing severity. So it's a real challenge. One of our members, LifeWorks by Morneau Shepell, is a global leader in this field. Morneau Shepell employs 6,000 people across 162 countries, and they have a LifeWorks division that really focuses on mental health and wellbeing services. It's the largest EAP company in the world. And we're fortunate to be joined today by Paula Allen, who's the Senior Vice President, Research, Analytics and Innovation, LifeWorks by Morneau Shepell. And Paula will be speaking to us from her Toronto office, where we're all envious. It's a beautiful sunny Wednesday afternoon over there. Now, LifeWorks by Morneau Shepell has been in Australia for 40 years, and the regional APAC headquarters is here in Melbourne. And we're also joined today by our good friend, Jamie McLennan, who's the Managing Director. It's great to have you here in cool old Melbourne, Jamie. I'd also like to acknowledge the Vecchi Deputy President, Adrian Cloden, and Board Director, Brian Negus, who are also on the line. And just a special shout out to the relatively new CEO of Gen U, who is Claire Amies. So welcome, Claire. Given your role as formerly the CEO of WorkSafe Victoria, we know you appreciate how important this topic is, and it's great to have everyone on the line, including a large contingent of managers from Bendigo Kangan Institute. Fantastic to have so many people here today. So this morning we'll start with an update on our advocacy by Paul Guerra, the Chief Executive of Vecchi, and then we'll pass to Paula to present the latest mental health index findings. Now, this is really current data, and she'll talk about the impacts of COVID and particularly how businesses can manage these impacts. Then I'll have a chat with Paula and we'll be able to delve a little bit deeper, focusing on some of the return to work implications and other insights for members. And we'll open up for a Q&A. And I can just encourage you all, even from now on, if you have any questions for Paul or Paula, please send them through on the chat function. And that's the best way for me to pick up on the questions, and I'll feed them through to Paula as we do a bit of Q&A later on. You're all in listen-only mode and the webinar is recorded. So first up, I'll now pass over to Paul Guerra to summarise the past week. Over to you, Paul.
Thanks, Diane. And Paula, welcome along. Zooming into Australia, great to have you here. Good to see you again too, Jamie. Our advocacy over the past probably 2 weeks has centred on a number of areas. The hospitality and events, which is such a significant part of the Melbourne, the Victorian lifestyle. We brought together a group of key people with the Minister and actually the Lord Mayor and Deputy Lord Mayor as well, and together with AHA and ourselves. Some of you would have read about that in the Herald Sun on the weekend, but we're hoping to get some really clear breakthroughs for hospitality and events, which will be really nice. The lockdown, we were consulted a lot about the lockdown before the state actually announced it. Ultimately, there was no choice. The numbers were getting out of control, and the data that the state has got, and they're actively using that, suggested that without the lockdown, the spread of the virus would have gone through us like wildfire. So although it's tough, we accept that it needs to be done. Rest assured, though, that we'll be pushing, if we can, to get that shorter than the 6 weeks. One of the things that we've spoken to the state around is if the metro gets locked down, let regional Victoria go. And I think you'll hear some commentary around that in the not too distant future as well. We've been pushing hard, and today's webinar is really timely. We've been speaking to the state around the need for some mental health support, and actually for some mentoring support as well. What we're picking up in pretty much across small to medium businesses in general is the need for that. So I'm not far off heading to the Premier's press conference today, where there'll be a full support package announced. And I'm optimistic about that aspect being included amongst some other cash support for businesses as well. We've also been in contact with the federal government, and I know they're keen to do something for Victorian-based businesses through this period as well. So there's been a lot of conversations at state level across the board. The other one that we're waiting on at the moment is the transport plan. As I said to Minister Allen, it's really hard for CBD-based businesses to plan what return to work look like until we know what the transport plan looks like as well. So that was urgent before the end of June, but of course with the lockdowns now, we want to make sure that we've got something in place before the end of July for that as well. So it has been a busy period, and I'm expecting to see some positive outcomes of the advocacy we've been doing in about half an hour from now.
Thank you very much, Paul. We're all looking forward to that. Now, for the main event, you've all seen Paula Allen's bio in the invitation. She's an expert in this field, well recognised in workplace mental health and productivity, among a whole range of other attributes. But I'd specifically like to mention that Paula we'll call her Pandemic Paula, perhaps, because Paula's actually designed and led the most comprehensive employer response to the H1N1 pandemic, the swine flu. I think she's been involved in every pandemic that's been going down over the past 20 years. But she's currently Morneau Shepell's Business Response and Resource Lead for the COVID-19 pandemic. Paula, thank you so much for sharing your research with us today.
Thank you very much. And I don't know how I've avoided being called Pandemic Paula before this. So anyway, it's a pleasure to be here. So I trust you can all see my screen, and it is truly a pleasure for me to have this conversation with you. You know, our organization, we deal with people every single day in organizations every single day, and it's never clearer than through our eyes how critical mental health is to the quality of an individual's life, to their ability to be physically healthy as well as their overall well-being, the work productivity, participation in the economy. There's really nothing that is not impacted by mental health. And with that, we realized that there was a gap in people's understanding of what was happening in terms of mental health. Basically, we have a number of different measures out there, but there really wasn't any very accessible measure for workplaces to understand what's happening in the community, what's happening in the population, what's happening amongst working individuals, and how different things in the environment, how different things in the economy, and how different initiatives that people are taking are impacting mental health. So this is why we spent a number of years actually preparing for the launch of our mental health index. And it's something that we would have done anyway, regardless of the pandemic, but we happened to launch it right when the pandemic was top of mind for virtually everyone. So I'll tell you a little bit about it. And I'll also tell you some of our findings. So in some cases, I'm going to talk about how all the 4 regions that we assessed compare: Australia, United States, Canada, and the United Kingdom. But most of my data will be specifically Australian data. So sharing with you how the working population in Australia is doing right now. So a bit about the index. Basically, we polled individuals, working individuals, representative of age, gender, industry, sub-geography, in all of the areas that I had mentioned. And we compared the results that we had starting in April, and then we have May and June. I'll share June results with you as well, to a benchmark that we've been collecting in 2017, 18, and 19. So a fairly stable period, some increase in work stress, but a really solid benchmark. And this data is being provided monthly. So as we are progressing through this pandemic period and even beyond it, we'll have an understanding of how the mental health of the population is doing, and most importantly, who's struggling, why, in a way that we can actually take action. So a little bit about the results. So the way the mental health index is structured, anything that is a negative score is a significant decline in mental health from the benchmark. And these numbers that you see in front of you are quite unfortunately astounding. We knew, based on our knowledge, based on experience with previous pandemics, we knew that there would be some mental health impact, but the size of the impact is absolutely unprecedented. When you're looking there at a score of -12, for example, which is where Australia is in June, that reflects the population in terms of anxiety, depression, decline in optimism, decline in work productivity, increase in isolation, all of those factors as being like the most distressed 1% of the population in the benchmark, which is prior to 2020. So just to pause for a moment. So the way the population looks now is similar to the most distressed 1% prior to 2020. Now, if that isn't a mental health crisis, I don't know what is. And again, not surprising, when you think of the extent of change, when you think of the unprecedented nature of disruption that we've had as a result of the pandemic, when you think of the fact that we're going into such periods of uncertainty, at one point everybody thought it would be over in June, and now we're thinking, there's a sort of an indefinite end in people's minds. So how you relate to your family, how you do your work, your economic security, all of that has changed in a way that we felt that we had no control over. Those are the types of things, that massive change, that unprecedented change, that disruption, the lack of and all of those things define trauma. And that's what our populations are experiencing right now. So you'll see that each of the geographies is slightly different in terms of their extent. That, when we started, everyone was at a different area level. Australia started out in a very compromised place, is actually improving, and the data that we collected for June was actually in the beginning of June, when things were looking like people were more likely to be opening up. But it is actually all very noteworthy in terms of the way each of our geographies are, and I would say virtually the entire world is in a situation of distress at this point. So a little bit more about what that looks like and what that means. So these are some of the scores in the sub-indices. So like I said, -12 is astoundingly difficult, but we even have lower than that in certain areas. Anxiety is an area that we're particularly compromised in, and not surprisingly, again, because there is so much that we are not sure of. There is so much that we feel that we don't have control over. Close behind, however, and this is Australian data, is work productivity. So typically what we would see is a decline in work productivity somewhat lagging the symptoms. For this situation, we actually saw a hard hit in terms of the mental health impact, and an equally hard hit at the same time in terms of work productivity. So people might be working more hours. This specifically is looking at difficulty at concentrating, which is something that is impacted by anxiety, feeling of being overwhelmed, deep sense of fatigue as a result of doing work that wouldn't have fatigued you before. This is something that business leaders need to pay attention to, because it has a direct impact, and it can't be sustained over the long term, because then you don't just have a short-term impact in terms of mental health, you have several different opportunities for longer-term impact. Triggering of mental health issues for some that are some clinical, acquiring mental health issues for those that didn't have it before, and on top of that, burnout with the population overall. So again, a clear call to action that we can't take this information and just say it's interesting. We need to do something about it, which I'm hoping we'll have as part of this conversation. A couple of other points. When we're looking at the driver of the decline in mental health, The strongest driver was actually finance, and this was for all of our regions. So economic uncertainty is really what is driving the greatest portion of anxiety. It doesn't mean that there aren't other things, and that's a part of the unfortunate thing. It isn't just that. It isn't just economic decline. It is that plus fear of illness, plus fear for your loved ones, plus many other things. But that was number one. And number two is isolation. So, not having that kind of connection between people that we need as human beings. And another factor is those without emergency savings. Another factor, a separate factor related to finance. Those without emergency savings, look at the number, negative 23.8. versus the overall group currently, which is negative 12. And I'd already explained to you, negative 12 is not a great place. And that was regardless of whether the person had a high income or not. So actually people who had modest incomes and emergency savings were doing better than those with higher incomes without. So another indication of where we can take action and control as much as possible as we're moving forward. So I'll go quickly through a few other pieces of information that kind of looks at different populations. And again, the whole population is impacted, but not everybody is being impacted equally. So what you'll see in front of you is where someone is in terms of their employment status makes a difference. So those who are currently employed, they might be working from home, they might be working in protected situations if they have to actually go outside of their homes, but they've had no change in their income. They are impacted. -9 is not anything to celebrate about, but much less so than other groups. And again, astoundingly, and again, we found this in all of our regions, those who had their salary reduced were the ones who had the most significant negative scores. So those are the groups with the lowest scores. Very, very important that business leaders understand this, because having somebody on the payroll and reducing their salary in order to maintain as many people on the payroll as possible is a good thing. But just because you are doing a good thing doesn't mean that it can't have negative impact, right? Just because it is the only option that is available and probably the best option at this point doesn't mean it doesn't put people at risk. So the important thing is that this has an impact. The uncertainty that you have when you have a reduced salary, are you still going to be able to make your bills? Is your salary ever going to return? Is your company actually solvent enough, for them, given that they have to take this strategy? That impacts people. So the call to action there is to pay attention to those individuals more than you otherwise would. Keeping someone on payroll isn't enough. They are having a response to the fact that there is yet another change in their life, and that brings tremendous uncertainty. Another thing that we found is that some employers have employee assistance programs, other employers do not. And we looked at those groups that did have an employee assistance program available to them. And regardless of whether they're using it at the moment, the mental health of that group was better. Those who didn't have access to an employee assistance program were more compromised. So this actually tells us that what you do and what you do on an ongoing basis makes a difference. Having that availability of support if you need it, you know that you can have that line. Your family might be using it, which takes pressure off you. You might have used it in the past, which builds up your resilience. The fact that it is there is positive. And the numbers, again, are unequivocal, statistically significant, and have been consistent in all regions. The next thing I'll share with you is information around age. And in age groups, it's not uniform in terms of the impact. Those who are younger, those who are earlier in their career, without question, are having a more difficult time. And again, think about it. If you are, you've just left school perhaps, or you're just starting your career, and then the world changes. That's a big thing. What is your next step going to be? Where are you going to get your guidance and mentorship? Are you perhaps one of the last in and perhaps one of the first out? You might not have the support structure of a family available to you. You just lost your family of origin or moved out and are not able to actually see them. The number of factors that actually make the younger population more vulnerable are significant. And again, a very important thing to pay attention to in terms of noting that in your organization. As people have been working from home, for example, if you're polling your employees, those who are in that 40, 50 age group might have teenagers at home, might be in a comfortable home and able to work quite well, are in a much different place than those that are younger, sharing a flat, not having anybody around, but also the uncertainty at the start of your career is more significant than uncertainty towards the end of your career. Another factor is, as I alluded to, is isolation. And what we're seeing here quite clearly is living alone is a risk factor. So again, when we're talking about reaching out to colleagues, when we're talking about reaching out to friends, if you yourself are someone who's living by yourself, isolation is something that impacts mental health and has been impacting mental health well before COVID actually started. Really what COVID has done is exacerbated it and made it so clear how social support is a critical part of our own well-being. So taking that action and reaching out, you might not be able to have the social systems that you did before, your dance classes, your meeting up at the restaurant, but just reaching out, and even to someone who might be an acquaintance, and asking how you're doing, striking up a conversation. It's good for you. It's good for them. It's essential for our society to take action where we're having deficit. And this is one area where we're having deficit, and we're seeing it more significantly in those who live alone. So I had mentioned the pandemic as being quite significant in terms of how it's impacting our populations. So asking individuals specifically whether the pandemic has had a negative impact on their mental health is actually revealing 72%, almost 3 in 4, are very conscious of the fact that it is having a negative impact on their mental health. There is always, and there always will be, a certain part of the population who denies, who is not necessarily conscious, who only will have that brought to their awareness when someone else says, something is not looking right, what's going on, you're looking more tense or not. But to have that as part of the consciousness of such a large part of the population is, again, really a call to action that we are no longer talking about 1 in 3 or 1 in 5. We are talking about everyone. We are talking about everyone. Think about it. There were certain professions like surgeons, etc., who had to take special precaution around hand washing and special precaution around sanity and infection risk. That was before. Now everyone does. At a certain point before, we talked about individuals at risk. We talked about people actually, stepping in when they see someone at risk. Everyone has risk. Everyone has always had risk. It is escalated right now. What I want you to leave with is that you as individuals, your spouse, your children, need to be active in terms of investing in mental health, need to know how to find your social supports, you need to know your action plan when things start to feel overwhelmed. This is too important to our well-being. This is too important to our economy and our businesses to be passive about it. If you are at risk, risk is not destiny, but the only way that we can change it is to make sure that we take action. A bit more about what is driving this risk. I've mentioned the financial impact, and again, 57% of us are saying that financial impact is really the thing that's on our minds the most and impacting our mental health and well-being. But this list is long. There are many other things, and again, which is what makes this so complicated. Fear of a loved one dying, 32% of us. Fear of getting ill, 29% indicating that there's strain on their family and relationships. This is huge. So, some of you might have seen, very unfortunately, news reports that during the pandemic, domestic violence had increased. That is one end of the continuum. But when you have things coming to light at one end of the continuum, it's an indication that the entire continuum is under pressure. And not to take that for granted. I mean, not even having the outlet of one-on-one time with your child, going to dance classes, spending too much time together, you yourself feeling concerned about financial issues or other issues or work issues, and it's spilling out with your family. There are many risk factors for families, and families really should be our strongest support. So it is something to pay attention to, and again, not take for granted. The next one and the last one in here, and this one I'll mention, is that overwork and overstrain. So recall what I had said before. People are saying that there has been more difficulty concentrating, more effort needed to be in work, more propensity for errors, basically more burden because of the mental health issues as a result of the pandemic that's impacting their work. And that's what we saw with the work productivity score. Feeling overworked is a part of that in terms of your perception, but many of us are doing more. There is just more to do, not only at work, but at home, and at work, more to consider. This is a perfect recipe for burnout for people. This is the definite risk for workplaces, and something that we as business leaders need to be aware of, and managers need to be aware of, so we can step in as appropriate. So a bit more about the impact on pandemic. We asked this month about, when things go back to, the relative normal, will you go back to your prior spending? And again, it was a bit surprising that it was a minority who said that they would. In Australia, only 24% said that they would definitely go back to their own spending. In every country, it was a minority. And in every country, there were other things that were presenting barriers. So worried, even if your income hadn't been impacted, but worried that there is a risk that will continue for quite some time, that is pulling people back. People worried people saying that their income has actually changed, and that's going to compromise them. People worried about infection and just going out and receiving services and being in businesses. So something that businesses need to pay attention to. We need to put people at ease. And then there was a portion of the group who just said that they just don't have the energy. They've just spent. So again, it's another indication that mental health matters. So even during the Depression, long after the Depression was over, there were people who had gone through it who never returned to their prior spending because there was nothing that was done to help build their optimism. There was nothing that was done to help them deal with the anxiety and the depression that actually resulted. They continued to have those kind of compromised thoughts, which resulted in compromised behaviors. These numbers align very closely with mental health, with the mental health numbers. So that proportion who said that they would go back to their spending, that was the group without question that had the best mental health scores, and those who were reluctant for one reason or another or several, those are the groups who had the lower scores. So again, much to say about why we need to pay attention to mental health, not even from a personal point of view, a business point of view, but also from a societal and economic point of view. Now, the other thing that was interesting in this data is we asked employees how well their employers were doing in terms of supporting their mental health during this difficult period. And about a third of employers said that a third of employees said, unfortunately, that their employers were supporting their mental health either inconsistently or poorly. And there's many reasons for that. Like, this has been a very difficult time for organizations. Some organizations are late in realizing that mental health is as important as physical health, but it does matter what you do. Those employees, as you see, those employees who had employers who managed their mental health somewhat to very well, their score in Australia was -7.8, which is much better than the average. And if you look at those who had employers who supported their mental health somewhat to very poorly, much lower scores. Like, this is as strong as you can get in terms of correlation. So what you do, sometimes we feel that we do so much and we wonder whether it has impact. It has impact. It does. In a previous survey, we found that 84% of employees said on a day-to-day basis, irrespective of pandemic, their employment, their workplace, what their employer does has an impact, positive or negative, but it does influence their mental health. So we all have power. That means that we all have responsibility. So a couple of quick things. We talked about the impact of COVID, and I'd spoken about why it is so impactful, the extent of change, the depth of the change, the number of areas change, the fact that we had no control over it, that taking away that sense of personal control and self-determination is huge in terms of having a mental health impact. So all of those features, as I mentioned, define trauma. And how we deal with trauma is fairly predictable from a human point of view. First, we have shock and denial. And I know that I had that myself. Like, is this really happening? Is this going to go away? It couldn't possibly be, as extensive as everybody is saying. And then you realize that it's true, that this is our new reality. Then very normally, we have anger, we have a bit of frustration, we have a bit of anxiety. That is very normal. What is not normal, what is concerning, is when that takes us over, when that becomes who we are, when that becomes your predominant way of showing up in the world. That is where we need to step in. And that's where it's so important that everybody have that plan around how you manage yourself on a day-to-day basis, how you manage your emotions. So you reach out to people, you know that the EAP is available, you get supports that you need. You also can manage some of the practical anxiety that you have around finances or something else by taking stock, and that helps with that short-term adjustment. We're going, however, into a period of heightened risk because most of us have not gotten to the point of long-term adjustment yet. Like, we're just managing through this short term, but second wave is coming. That means that without getting through, we are going back to that stage 1 or stage 2. So the likelihood that we'll be stuck in anger, frustration, or anxiety is much higher. So everything that I had said before about the importance of what employers do, about the importance of how we model behavior, how we step in with friends and coworkers and employees has never been more important than it is right now, because we have never really experienced this in exactly the same way that we're experiencing mental health risk now as a society. And finally, I will just say this is not a short-term issue. It is something that I believe most people will get through well, but there is some people who won't. And I do not want to roll dice on myself or anyone else. I want to make sure that the odds are stacked in my favor. The quarantine aspect, the isolation aspect is a huge aspect on top of everything that I'd mentioned to you before about uncertainty, financial uncertainty, change in routine, all of that. And a lesson learned from SARS is that those who experienced just that aspect of it during SARS were significantly more likely to be experiencing post-traumatic stress, trauma-related disorder, high depressive symptoms 3 years after the event had resolved itself. So again, my last word here is really, now is the time more than ever that we need to take care of our mental health and well-being. We cannot be passive about this because the stakes are too high, the risk is too high. So I really am pleased that you're having this session right now and that we're having this conversation. And a few points just to take away. Number one, for sure, the pandemic has a negative impact on mental health. I think I've made that point quite clear. Some people don't quite get that point. It's important for us all to understand it. It impacts productivity, it impacts the economy, and employers can make a difference. So just a few things to take away around what those employers were doing who had employees who are doing well. Increasing awareness, making sure you're addressing stigma that is a barrier to people reaching out. Providing recognition to individuals whenever any of us is under strain. Our need for, our craving for the benefit of recognition of what you are trying to do becomes more important. Training managers, making sure that your people have access to resources, in particular EAP, that can manage a range of issues. And I'd also suggest that you consider, using survey tools to take the temperature on how your people are. So if you are going in a decline situation, or if there's certain populations that are going in a decline, you know about it and can take action, and you know what your level of risk on an organizational level actually is. So that is the information that I'm privileged to share with you today, and I'm very, very interested in hearing what everyone else has to say, and any kind of questions that might come up.
Thank you so much, Paula. We really, really appreciate that. And we've got questions coming through. Just the first thing to note, the presentation, Paula is very happy to share it post the session, so everyone will have access to that. And Paula, there were just two survey questions. In particular, Rowan Sadler from Bendigo Bank was keen to know whether or not the data is available on a state-by-state basis in Australia.
Yes, we broke down some of the top level scores by each of the states. So in addition to making available the presentation, I'll also make sure that everyone has access to, and we can send out the results, the actual report that does have the data broken down by state.
Fantastic. And also from Phoebe C, if you could share any information about the questions used to capture the data, maybe we can do that following the session.
Okay, that's good.
Okay, fantastic. Paula, what mental health challenges do you anticipate as for employees as we move through to the recovery phase? You've given a fantastic summary of what's actually happening now and what has led up to this position, but what do you think as we move through the recovery and beyond? Will it change much?
I think that a lot of it remains to be seen because we're not really sure what that recovery is going to look like. I mean, what we're sort of experiencing right now, and many regions are experiencing, is a very unstable recovery. Like you move 2 steps forward, you move 1 step back. It's not linear. So it's definitely not as positive from a mental health point of view as if there was something that was definitely linear, stepwise. You're going to get out of it. You can see all indications of your personal life, your work life, and your financial situation kind of getting back to a different place. And there's a lot of discussion around things changing, forever. There's certain things that might be different for the long term, how we work, how we interact with people. There's a lot of attention right now and a lot of positivity around having a vaccine. But if there is no vaccine, we might need to be shaping our behaviors quite a bit differently going forward. So I don't think that this is going to be a very clean recovery. I do think what we'll see is human beings being resilient as they always are. We will see, people rebounding. We will see the mental health indicators improving, but we will be in a state of heightened risk for a long period of time, which means that even if, you know, a group is recovering, if you recover in a position of high risk, if you recover in a position of frailty, it doesn't take much to push you back. So that's what we need to be paying attention to for quite some time. Even as we see these numbers improve, it doesn't mean that they can't immediately go back into a negative state, or any individual might not be pushed in a negative state as things don't go as well as they might hope, or if as life stresses, which we always had, but even before, don't come into play.
Thank you. And specifically, when people do start coming back into workplaces, I found myself this morning, I haven't been into the office for quite some time, and even just that stress when you actually have your temperature taken, I thought, oh my goodness, imagine if I've got a temperature and I can't do the webinar. So all of this is anxiety inducing. And I just wondered, are there particular comments you'd like to make about the challenges employees are going to face when they actually do get back into the physical working environments?
Yeah, and we're seeing indications of it right now. I mean, there's a continuum in terms of how people are responding. There's some people this couldn't happen fast enough for them. You know, they're going to go in, they're going to take their chances. They're not thinking about this. They're pretty bold, and you know, that's just how they are. And that might be how they are in all areas of life. And that there are other people who are absolutely terrified, and there's many in between. I think for all of us, though, what we have to realize, and I've mentioned this a few times, is don't underestimate, you know, how difficult change is. Just the fact that it is different. Like, even if you're not harboring a fair bit of anxiety about returning, things are different. It's going to feel out of sorts. You are going to wonder, you know, are you doing the right thing? Is somebody else doing the right thing? Or just feel that sense of discomfort. Employers have to understand that the level of flexibility and mental flexibility and routine flexibility and the amount of change that their employees are going through is wrapping around the world twice right now. And this is on top of all the business change that's part of our regular lives. So that flexibility really requires us to sort of be very empathetic in how we're communicating with employees. So we're clear, you know, we're repeating things, you know, there's no real place for short tempers when everything is under this strain. You know, checking in on people, are they doing okay? Just making sure that human connection has never been stronger in our workplace, because it has never been more needed. I've seen it happen in some workplaces, and I've seen the opposite in workplaces, and it makes a difference. Yeah. So how you relate to your employees, how you speak to them, how you care, how you show genuine human concern, what you make available to them has never been more important, because this change is going to last a long time, and change is hard.
Paula, we're going to have to finish soon, and I've got about 16 questions I'd like to ask you myself, but just one final brief comment. Are there any particular long-term implications you think businesses should be thinking about now, given this data?
Yeah, and I think I would go back to the other comment, is that we are going to be in a high-risk situation for quite some time. So let me just sort of refer you back to this whole concept of trauma. The pandemic checks all the boxes of a global trauma, period, right? And when you have a trauma, you are in a vulnerable state for quite some time. Number one, you want to make sure that you're addressing the issues as quickly as possible, that you have the opportunity to speak through what your responses are, to make sure that you're not letting yourself get into that anger or frustration, because it's very, very hard to get out. That you have as much social support as possible, that you have the benefit of a counselor to help you, even for a one-session intervention if need be, so you don't feel overwhelmed. So that's part of your risk management. But even if you do all of that, the risk continues for a while. So I do think, and interestingly enough, even investors have started to realize this, like hard-nosed investors are paying attention to what employers do for their people, because they know that is going to be a part of their business success.
Yeah.
People are watching. You know, employees are paying attention to how you manage, and their engagement is going to be important because this has become more important to them. Investors are watching those employers who do well through this, and the way to do well is to support your people. So I do think the long-term implication is that mental health will be much more important as a business issue than it ever has been before.
Thank you so much, Paula. I'm sad to say we're going to have to wrap this now. It's been a really rich discussion. The data is fantastic. Thank you so much for sharing it with us. We really appreciate your contribution today, and also thanks very much to Jamie McLennan for helping us set all of this up. In the follow-up email, we'll send you the presentation, we'll send you some links and some other documents from LifeWorks by Morneau Shepell, so you can actually see the full study, and I'm sure that will be helpful. I also just want to say there are probably three takeouts that I had from today's session. First is that the data is definitely showing everyone is affected. It's a business issue. You need to have, particularly if you're large complex organisations like many of the participants on the line today, you need to have a mental health, an organisation-wide mental health strategy, and need to take action. That's clearly what's coming through. Second thing is there's so much advice, support and tools available, even just through LifeWorks by Morneau Shepell, many of our other members. I mentioned Genu earlier, but across the board, people are there to help. Just from the Chamber's perspective, we also have some incredible courses which are all now virtual, so you can invest in some training to help with the challenge we're all dealing with. For example, mental health first aid, mental health fundamentals for managers, they're all good entry point courses. So our consultants can also help with strategy work, and you can use your member credit for that. So there's so many ways to help out. And finally, a key message is for people not to be isolated. So stay connected. Stay connected. We're looking forward to staying connected with you. It was some sobering statistics, but I think it's also really important to have the data, and Paula and Jamie were able to facilitate that for us today. We are really looking forward to, at the Chamber, getting Victorians back to work safely and back to business. It's certainly something we're very focused on. So just in closing, I'd like to announce that our next webinar, the 12th in the series, is on risk and resilience, and it'll build beautifully on what Paula has discussed today, and it's with an expert in this field, Roger Perry from the Bevington Group, next Thursday, the 16th at 1 p.m. So until then, thank you for joining us.